So, hi everybody, and welcome back to another episode of the Health Data Ethics Podcast. I'm really excited because today I get to share expertise with my friend John. John, do you want to introduce yourself?
Yes, welcome everybody. Jennifer, thank you very much for having me. My name is John Valutkevich. About 25 years in the healthcare IT industry. I'm currently with Drummond. I've been there about 6 years where I've led O&C grant initiatives, and I currently have responsibilities for HL7 fire testing and compliance, as well as AI risk management. And then prior to that, some 20 plus years in the EHR industry and storage as well, product management, development, and compliance. So happy to be here.
This is amazing. I feel like there are so many areas where our interests align, and I was so excited when Drummond reached out to talk about this report that you recently did. And we're gonna dive into it a little bit, but first, can you give me a high-level overview of what the report contains, and tell me about why you started it in the first place?
Sure, yeah. So the report from Drummond is called Securing AI, Creating Adoption and Ready Health IT Solutions. And what we were able to do is we have the benefits of a large swath of EHR customers, compliance customers, health IT app developers, and we get a lot of feedback from our customer base about obviously artificial intelligence and its adoption. It's gaining momentum, it's going along quite quickly. And what we wanted to do is to say, is there a gap between what we call interest in AI, which we know if you look at any hype cycles and all is obviously very high, and how the industry, at least from a healthcare IT perspective, is looking at adoption. How ready are EHR developers, payers, interface developers, and then really most importantly is those tool sets and adoption are one area, and I know we'll talk a little bit about that in the webinar here today, Jennifer, is also looking at user adoption, obviously from a clinical perspective and the infusion of AI decision making and general and administrative policy and procedure things such as admissions, efficiency applications. So there's likely a gap. We believe that's been measured in the questionnaire and the report, and I know you're going to touch on some of the key findings that we had, but we were pleased with the feedback from EHR developers. We actually had provider users who used the EHRs and other industry experts weigh in on this report.
I think one of the things that made this report so interesting to me was the inclusion of the EHR developer perspective. Because, with my day job at Cleveland Clinic, I am an end user of the EHR, and actually less an end user of the EHR and more an end user of the data that's in it. So I was very interested to get a glimpse into the perspective a couple of steps upstream. The first thing that really stuck out to me in the report was that EHR developers and healthcare providers both overwhelmingly indicated they had a lot of anticipation that their organization's use of AI was going to increase either moderately or significantly over the next 2 years. But the healthcare providers indicated a very limited adoption of AI for patient care purposes. So I'm curious to know, how do you interpret this? Does this indicate maybe some unexpected opportunities for AI implementation? And if we're a decision maker, how do we take this information into account?
Yeah, I think those are two really good points in terms of it. And it was sort of what I expected. Again, I'm only a couple of years removed from the EHR developer environment and obviously stay in touch with many of them. And I think we looked at that and I said, my initial reaction is, well, trust is key, right? So we've heard trust married with AI throughout its early inclusion and adoption and a go-forward strategy. It's really important. So when you think about the outcomes from adoption of AI, and if I'm an EHR developer and I'm tailoring my solution to my end users, adoption of AI, use of AI, to be frank, right, it can be more detrimental in the clinical care versus the general administrative process for things like scheduling or efficiency apps if something heads south.
The risks are high. Yeah.
Yeah, exactly. The risk is very high to leverage an AI solution. And again, I thought we're going to get into more of, well, they're well vetted and they're clinical and general administrative users that help support that. But it's the EHR industry, they see an opportunity, obviously, to offer their end users more efficiency-related tools. There's competition there, let's be frank there too. Large players, the Microsofts and the Googles are somewhat an easier decision maybe in terms of adoption versus what I would call the specialty apps. And I'll liken them to akin to the explosion of fire apps and fire clients augmenting workflow. So that's a whole other undertaking, right? There has to be the opportunity here is thoughtful adoption and inclusion in workflow. It's a big consideration. Whenever you add or adopt technology, you do have to, you mentioned it correctly, Jennifer, downstream, the end user such as yourself. How easy is it to get to that data, use that data? If it's more mouse clicks or other types of screens that have to pop up and I have to cut and paste or view, it's thoughtful adoption is key. It won't work. And then understanding the role of the app, the way it was built, tested, and more importantly, a lot of new entrants to the game. Are you going to be around in 2 to 3 years from now? Because we're only at the beginning of AI adoption. One other final comment has to do with explainability, and that is a term that's being used to address what we would call behind the curtain of your AI application. The EHR industry in particular has had some help with the Office of National Coordinator, ASTP. They set the bar with their measurement of predictive decision support intervention and rules for EHR, whether they incorporated and built their own AI or you leverage third parties to help measure source attributes and define what it means to have a risk management policy. So, and there are some of these rulings that are even being adopted at a state level here in the United States, and they're taking their cues in the EU and Canada. So understanding those perspectives, I think, is the opportunity for EHR developers and AI app developers that want to augment and channel, partner with EHRs and payers. It's going to be really important to address those things.
Yeah, I couldn't agree more. And I really want to call our attention to figure 10 in the report. And I'm actually going to throw it up over my face here while you're talking so everybody can take a look at it. But I wanted to talk about risk management and governance. And I wanted to ask you two questions on this. One was I wanted to ask you for your insight on comparing and contrasting the actions that are being taken by EHR developers versus healthcare providers. And then I wanted to sort of think about the actions that you've got broken out on this figure. A lot of these are organizational, right? You can appoint a chief AI officer, you can set up a governance process, or they're data driven like the ISO standards. What about governing the clinical or the operational actions that are taken based on the output of AI tools? And then I've got my example that I always think about is, let's say you've got a well-validated, non-biased AI model that predicts a no-show rate. Okay, so what do you do with that output? Do you double book the patient, or do you call them to offer transportation?
Great, yeah, and that's an excellent example of the fact that it's the adoption end that's really, really critical. And I think we've had some help, maybe just setting the bar here a little bit from the industry. So you have the CHI applied model card. You have work from Duke Labs. Like I said, you have legislation that's pointing to what's occurring with O&C. And now I'll even call out from an EHR perspective and an adoption perspective, what happens within the walls of these provider organizations, like you mentioned. And we now know that the Joint Commission is going to get involved in concert with CHI to take a look at that. So that's pretty important. And I think one of the other things driving it is as you look at that graphic there, Jennifer, it's pretty interesting to say that where healthcare providers have larger concerns. You're looking at the blue versus the EHR developers in the gold in some of the aspects, whereas establishing protocols and in data privacy to me stuck out as they're dead even. So in terms of exposure and risk there. So I think it's important to probably realize that the healthcare providers and EHR developers, they're looking from a management perspective to cooperation amongst each other because of the concerns of the end user, whether it is from a clinical adoption perspective or a general administrative adoption perspective. So that's how we sort of saw that with Drummond. And again, I think we've gotten some feedback independently here from some of our customers, which are EHR developers, really supporting that perspective.
Yeah, absolutely. Thank you for sharing that. That's amazing. I feel like we could spend a long time digging into all of the various, like the contrast between EHR developers and healthcare providers. And then the really interesting thing, I'm thinking, if you're reading this from a healthcare provider perspective, what would you advise somebody to do if I want to look at this report and then act on it? Do you have thoughts on action items or next steps we can take?
I do, and again, I agree with you. But how many hours do we have to continue this? But and again, I love leaning, and part of my role at Drummond continues to be one of the reasons I am here is that background with EHRs and those end users. Nothing better I like than product management and involving the actual end users. But back to answer your question in terms of, what about the end users of these solutions? What do they want to look for as they look through really what can be still a emerging, confusing time? Much like I would call out again the Fire app world, it's a bit of the Wild West out there. There are many vendors popping up in the AI app world, and it's getting hard to discern from an EHR or payer perspective what is the value add and what are the intentions. How do you know the good ones from the bad actors and new entrants hoping to capitalize? I can say, and you've probably had this experience as well. You go to a couple of our industry trade shows, HIMSS and Vive, and the influx and the growth of those areas for AI applications and decision support, it's exploded exponentially over the last 2 years in particular. So from a Drummond perspective, we're listening to our end users and our customer base, and there's this plea from, well, ONC is very much focused, and there are rules for the EHR developers, but rules really only for them. And there's an expectation there from the EHR and now the payers as well, that they want their AI vendors to carry the load. Make it easier for them to choose your solutions. I would say to the end users that as you look at the industry, there's help out there. Look at your EHR source of truth. Typically, the EHR that's deployed within the walls of a healthcare organization, they will have a list or maybe an app store. These are the ones that they've least vetted. Then you can go a tier down from that, and organizations like yours, I'm sure, with a wealth of IT resources, will also say if it's good enough for the EHR, that's one thing, but we have a responsibility to our end users and our patient data. So you put it through its paces again and probably roll out adoption strategies like service packs and things like that. So there's also help uniquely in the AI world. Like I say, you do have ONC given the EHR's guidance. We have actually taken that guidance and applied it to a standalone program. We've had some standalone AI app vendors go through a risk management program that helps those EHRs, those large-scale EHRs that have a lot of customers are constantly getting barraged with requests to partner, put me in your channel. And it's getting hard to referee all that. So I think with Chai, with what we're doing here at Drummond, you look at cues from ONC, there's help out there to help you decide that while the look and feel of an output from a AI app vendor might be one thing, turn to your EHR as a source of truth, your payers as a source of truth. And then we're certainly here to help augment and actually take direct questions. We have providers that use the EHRs that we certify come directly to us with questions and answers and guidance. So it's certainly a great opportunity here for adoption of AI. And there's help out there to help you meter out and discuss and find that explainability that's so important about what is this AI really like behind the curtain.
Yeah. Your comments on explainability in particular are so in alignment with my thoughts on the best ways to build trust and to do good governance. I mean, the AI as a black box, whether it's internally developed or externally developed, just isn't going to hold for very long. John, right. I could talk with you for hours on this, and probably will over the course of the next few weeks. So tell me when. Okay, so first of all, tell me if people are interested in reading this report after they've heard us chat about it. Where can they find it?
Yeah, it's actually available directly on our website. So drummondgroup.com, Jennifer. One of our leading indicators for resources is AI. And this particular report entitled Securing AI, Creating Adoption-Ready Health IT Solutions. And again, if there's any information that customers or prospects or anybody that's a fan of your podcast, I know you have many, they can reach me directly through you as well. Happy to provide a follow-up or a direct link, and you can share that out in this webinar.
Absolutely. I will be happy to connect folks to you as well if I get any other questions. John, are there any questions you want to answer that I haven't asked you today? Is there any information that you feel like you need to share?
Honestly, Jennifer, I can't say there is. You and I had a great prep session, in terms of what you're able to provide here in terms of this podcast. I think in terms of a good, concise look at AI adoption. I'm an end user. I'm an EHR developer. I'm in the payer world, or I'm a standalone AI application developer. I'm going to steer myself, I think, to short bursts like this to get some initial education. And then it's more of probably a direct follow-up in as it relates to what we do here at Drummond. It's very easy accessible, linkages out to the Chai website, for instance. So plenty of resources out there. So I feel like we were able to cover at a high level a good look at what's occurring from AI adoption and end user provider perspectives.
It's fantastic. Thank you so much. You heard it here. If you're an AI developer, you want to get your app into the EHR, call the Drummond Group. They can help you out. And yeah, thank you so much, John. Truly appreciate you sharing your time with me. Truly appreciate you sharing this report. This has given me lots to think about. Very grateful for your expertise and for the chance to build this relationship with you. I hope this is not the last time we get a chance to chat.
I hope not so either, because like I say, you have a great audience out there, Jennifer, and this is a valuable, really high acumen, simple way to get some great information about the industry. So I appreciate the opportunity and wish you well.
Thank you so much.